Good morning from London. This is Dr. Shabih Zaidi, and I'm at your service. I'm grateful to Dr. Salma Kundi and the organizers for inviting me to this very prestigious conference. If you'd allow me to share the screen, then I can straight away start with the topic because I have only 15 minutes. Can you hear me? Hello? Okay.
Yes, sir, we can hear you.
All right. So let's start. If I can share my screen, then we can talk about it straight away. It's a very interesting topic and it's a very challenging topic. In fact, I did a talk on this particular topic some 20 years ago in Australia. So let me go on to the slideshow. Is that okay? Can you see and hear me?
Yeah.
All right. Okay, so this is the topic I was given. There was slight change in the topic, but what was published compared to what I've given to talk. But this is a very fascinating subject, particularly in the recent times, so ethical decision-making in resource-limited clinical settings. And that it really is a challenge. So let's start at the beginning, because ethics is something which is not very familiar in our parts of the world. Even in the UK, it's only recently they've started teaching ethics in the medical schools longitudinally across the contextual curriculums. But in Pakistan, I remember we started this campaign in 1994 with Professor Zaki Hassan, Chaka Javed, Maqbul Jafri, and others, when we wrote the first book. And now, thank God, it's coming to life, and we are witnessing the radical change. So ethics is a branch of philosophy. The mother philosophy has four other daughters: logic, metaphysics, aesthetics, and politics. Some people include religion also, but I think that's not fair, because religion combined with philosophy is just called theosophy, of which Mullah Sadra was the greatest scholar that I know. Now, what is ethics? It guides us in differentiation. It provides a pathways to differentiate between good and evil. And I'll just rapidly go through the normative principles of ethics which are developed in the West. The first one that comes to mind is deontology, which was developed by Immanuel Kant, a famous German scholar who believed in duty and reasoning. And he said that if you're called to a duty, your ends and means should both be good. So if you have objectives in life which are honest and fair, you will achieve good results. Utilitarianism came much later, and that was introduced by, well, I mean, time-wise probably the same, but it came into prominence much later. Utilitarianism was introduced by Mills and Bentham. We saw many examples of utilitarianism in the recent time when we had the COVID-19. Virtue ethics is my favorite. It's been there for a long, long time. It was introduced by Plato and Aristotle. And then it went into sleep for about 2,500 years until McIntyre, who revived it in the late 1960s and 70s. McIntyre just passed away recently in the May of this year. Virtue ethics basically means in developing the character. Your character should be strong. It should do an act of goodness and naturally, instinctively, automatically, and repetitively, unlike deontology, which is duty-based, or utilitarianism, which is maximizing the benefits. So virtue ethics is what is very close to Islamic teachings also. There are many virtues, but the famous Platonic virtues are courage, compassion, practical wisdom, which is called experiential learning in medical education, and justice. Now, justice is a universal norm. It is a principle of ethics which is there forever. Am I okay? Because somebody's messaging me that, okay. So anyway, I'll just go on. So justice, we'll talk briefly about it. Now, what is justice? It's been defined in various ways, but my favorite definition is this, that, and I quote, giving one what is one's due, giving one what is one's due. And justice comes into all kinds of ethics, like universal ethics, secular ethics, doctrines of theosophy and religion or whatever. Justice is a fundamental principle of ethics in all matters of life and death. There are various definitions and divisions of justice, but these are the four that matters most. Distributive justice, which I'll talk briefly in a moment. Retributive, was you give a reprieval to a person, somebody who's done a mistake, says, all right, come back, you've been warned, etc. Reprimand, call him back. Punitive justice, where you give punishment for a crime committed or a mistake committed. Now, the important thing is that punitive justice means that the crime and the punishment should match. It's not right that it's a minor crime, you give punishment of exorbitant nature, so that will be wrong. Reformative is very commonly seen in clinical practice. You do a mistake or your procedure is not up to date, you go back to a workshop or a clinical setting or a school or college or a course, come back and with a reformed attitude in life and clinical skills, etc. Now, Western principles they recently came into prominence. We wrote a book in 1994, and we didn't know about these principles. We just wrote what we thought is the best interest of patient. But now they've been defined by Bucham and Childress, which came in 1990. I think they was published in 1980s, but I came to know from 1999 or 2000. These are the principles which are cardinal rules now. Autonomy, which means khud mukhtari. Beneficence, which is you benefit the patient, that is your objective. Non-maleficence, that during the clinical services, you want to avoid any harm to the patient. And justice, the universal principle that I briefly talked about. Islamic doctrines are very simple. They come from Quran and Sunnah, Amr bil Maruf and here Anil Munkar. That's a famous ayat which has been mentioned in Quran at least 29 times. The practical application in medical science is la zarar fi la zarar. That means do no harm and you will not be harmed. So do not expect any harm if you're harmless or you do not cause any harm to anybody. In return, you expect no harm to be done to you. And the principles that we have derived, I worked on it for many years, are al-takrim, that means dignity, bir means beneficence, adl, of course, justice, and ihsan, which is the higher quality of adl. It's much superior to adl. That is why in Quran, in Surah Rahman, there is a famous ayat, Khal jaza al-ihsan illa al-ihsan, that if you goodness, the reward of goodness is nothing but goodness. But ihsan is the only ultimate over ihsan is something attributed only to God and is fazl karam. All right. Now, distributive justice, I briefly talked about. It's a concept in ethics which believes that allocation of resources, benefits, and burden should be equitable in the society, and they should be given to the persons according to their demands and requirements, etc. It addresses questions of how wealth, opportunity, and privileges should be distributed with fairness and equity. Now, these two terms, fairness, equity, need further explanation, which I'll do in a moment. Now, in terms of when I translate into Islamic philosophy, and this is something that you can correct me if I'm wrong, equality is masawat. Islam believes in masawat, that they give whatever resources you have, you distribute them to the best of your abilities to maximize the benefits. That is where utilitarianism also comes into practice, which is a branch of what's called consequentialism. That means that you give whatever resources you have, distribute them equally across the community. Now, that raises a major question, that if your resource is limited, then how can you distribute it equally to everybody? And that is where a new thing that I have come up from learning to scholars in Islamic theology, mawasat. Mawasat is different to masawat. Masawat was equality. Mawasat is equity. Unlike strict equality, equity considers individual circumstances and needs. So it advocates that if somebody needs shelter, you give shelter. If somebody needs food, you give them food. So if somebody needs, like during the COVID era, we saw that if somebody needed oxygen, the other person needed a mask, somebody needed a bed. So you can equate, you maximize your benefits. So limited resources can be expended according to needs, based on needs and merit of the people. Do not generalize it, but distribute according to needs. And this, I think, appeals to my common sense. Mawasat probably is better than masawat. And this, like I said, utilitarianism introduced by Bentham and Mills. The ends can justify the means. Remember, in deontology, the means and ends should both be good. In utilitarian, the ends can be, if the ends are good, the means may be bad. So, for example, in a community, you catch a robber and punish him. Catching a robber or maybe hit him, like, it happens often in Pakistan, they hit the person, slap across the face, etc., or head or whatever. And it is not fair. It's not good. It's not, but you're saving the community from the harm that this person could bring. Therefore, you can justify the means to a good end. This is the principle of utilitarianism. Fairness is very difficult to judge, but distributive justice is based on the fundamental principle of fairness. Now, fairness also means that should be fair, not the authority should be fair in distribution of resources, and they should be answerable. They should be transparent in their application. They should be auditable. Somebody should be able to challenge their authority in terms of fairness. Now, very difficult, I dare say, in Pakistan, but this is how it should be practiced. Then there are other components in distributive justice. Need is important, that, in particular during the days of Salah, for example, the floods and the deluge that we have in Pakistan, everybody needs help, and you have to give help according, if you want to maximize your resources, then you have to pick and choose what is needed best for a particular community. You cannot generally give everything to everybody because you'll run out of resources. Same applies to clinical services. You have limited resources in the hospital, in your setting, etc. You have to maximize the benefits based upon need, and that is where mawasat is better than masawat. My favorite theory in philosophy, there are lots of theories I keep reading and listening, etc., etc. Only yesterday I was listening to a beautiful Urdu translation of Will Durant's famous book of History of Philosophers. You must read it if you can. It's available on YouTube. John Rawls was a famous philosopher who passed away recently, in 2002. He gave a theory which is called social contract theory, where the level playing field should be given. Able bodies should compete with able bodies and disabled with disabled. Now, this is a wonderful principle in terms of theory. It was used by NHS when it first came to application in 1948. And where it means that the first point of contact service, in fact, in the UK, all services are free. Only recently it's been polluted by greedy investors and money makers, etc. But the point of contact here was that you give services equitably to everybody who needs it. And that was the social contract theory, which is my favorite theory. If you get a chance, please read John Rawls' Theory of Social Contract. Now, the practical example of distributed justice are manifold. We saw that during the COVID-19, like I mentioned, that the resources in the initial stages were limited. We had no PPEs, we had no ventilators, no oxygen. It was very difficult. In fact, my friend Shabih actually passed away. He was a GP in south of England, where he jumped to treat a patient with COVID. Nobody knew. It was the first few days of COVID, no facilities available. He succumbed to it. But the point I'm making is that you have to distribute the services according to the needs of the people. And that's why you can maximize it. I'm almost there. Education also, you should read this report, Mammoth 1 and 2 report, which is given used or probably which is studied in the UK, North and South, but very aptly applicable to Pakistan. How do you maximize the benefits? I'm almost to the end. The current challenges are limited. Funding is always there. Demands are always increasing. Supplies are limited. Equities. So all these factors are ethical questions which only experts can understand and guide you. Then there's a question of high impact interventions. Sometimes you have to differentiate between different services. What is the best practice you can use in a clinical scenario in a particular situation? It must be contextual. You cannot apply the principles that are used in the UK and in Pakistan or vice versa. You have to, but certain principles are universal, like I mentioned earlier on. The role of community is important. It's all happening in the UK. Outpatient services are given out to the community, and hospital takes care of only the inpatient. That is maximizing the benefits and services. Technology has taken online digital courses. Online, the Sadiq Virtual University, which I represent, is giving a lot of services in terms of health education services, which are cost effective, free almost to people. But I would like to invite anybody who's interested to join a program of CHP and postgraduate diplomas, which are global learning. Now, the new thing that's coming up, all apart from online education, the MOOCs and microlearning and Ankis, all these flashcards are being used by students in the Imperials and Georgia's, Barts, etc. in the UK, and I'm sure same applies to Pakistan also. So the lecture rooms have become almost redundant, and the new technology, the flipped classrooms, and of course, micro-learning to micro-credentialing is the in thing. That is how you can maximize your educational services. Then you can have partnership with the NGOs, which is a very common practice in Pakistan because Pakistan is living on charity, and thank God for that. So my final message is that mawasat and masawat. Look at both these elements. Masawat is good, but mawasat probably is more applicable when your resources are limited. There's a book that recently published. It's a compilation of a lot of authors' work, 40 plus authors from all over the world. I was the chief editor and the main writer for this book, the Encyclopedia of Islamic Medical Ethics, which is available on Amazon. If you'd like to have a copy in your library, it might be worth it. And thank you so much for listening to me. If you have any questions, I'm at your service. I'll try to do as best as I can. Sincerely thankful. Over to you. If you have any questions, I'm open to any questions. Thank you. My talk is over. Any questions?
Thank you. Thank you so much, sir. There is no question from the audience. Thank you so much.
All right. Take good care then. Bye-bye. I'll take your leave then.